Good morning, friends. It's Saturday, March the 14th, and just wanted to take a few minutes to chat with you about the current situation, status of the COVID-19 outbreak here in the New Orleans metropolitan area. I believe there are currently 36 cases in Orleans Parish, 7 in Jefferson, 2 to my knowledge in St. Tammany, and then um, also a few cases in other adjacent counties. So at this time, there are clearly approaching 50 cases in the metropolitan area. And one can reasonably assume, since most of those are in the more severe end of the spectrum, which makes up about 20% of cases total, that we have about 5 to 10 times that many infected people here in the metropolitan area right now. I say that not to alarm you, but to give you a notion of the fact that about 80% of people have mild symptoms or no symptoms at all when infected with this virus. And while we're still learning about how effectively they can transmit, it does appear that some of them can. And consequently, it's important for all of us as a means to protect ourselves and the people that we care about. Stay in, avoid person to person, face to face contact for the most part, except for people in our immediate households and folks with whom we really need to maintain in person contact that is critical. Those at greatest risk are certainly the folks who are 65 and older, with risk increasing even in that category with further advancing age, and also folks with pre-existing underlying conditions like cardiac disease, respiratory disease, advanced liver or kidney disease, serious diabetes that's poorly controlled with complications, and some people with immune compromise, particularly folks on chemotherapy and the like. In those categories, those with more severe and less well-controlled disease, for example, poorly controlled congestive heart failure, would be at greater risk for serious outcomes than people with well-controlled coronary artery disease or hypertension who are not generally symptomatic. That's just to give you a frame of reference again. Frankly, at this point, it's important for all of us, whether we consider ourselves at high risk or not, to practice social distancing, that is, limiting the number of face-to-face contacts within about 6 feet with other people, particularly outside our household, as a means not only of protecting ourselves, but protecting others. Because if we don't get infected, we can't infect somebody else. And this is a critical step in the process of trying to limit the rapidity of spread of this disease so that we can be sure that our healthcare capacity is not overwhelmed, and also so we can buy some time for treatments to be developed and deployed for this disease to make it milder and to limit the number of fatalities from the disease as spread continues over the coming weeks and likely months. I think we're likely to stay in this situation of limiting person-to-person contact to a significant extent for at least the next 4 to 8 weeks here in the city. We can expect there to continue to be a doubling of cases every day or so for at least the next week to 10 days, because the people who are currently showing advanced symptoms and are being recognized with disease were exposed at least 2 to 14 days ago. And in fact, on average, about 4 or 5 days is when people start to show symptoms. But the more advanced symptoms that are likely the ones being recognized for the most part right now occur typically in the second week of infection, sometimes a bit sooner. So we've had this virus circulating for a while now in the community. And I say that not to cause you to panic, but rather so that you understand the situation that we're in. So what else can you do? Wash your hands thoroughly. What do I mean by that? For 20 seconds, really wash your hands with soap and water, rather like that. twice as long as it takes you to sing happy birthday. Soap actually breaks down the envelope around the coronavirus, causes it to disintegrate, and it can infect cells when that happens. So it's a more effective way actually to limit your exposure and others than hand sanitizers. So don't be panicked that they're all out of stock at the moment. The only time it's really better to use hand sanitizers if you can't wash your hands. Frequent hand washing, even at home, is really good. The virus can live on surfaces for a period of time. We know at least 2 hours. In some circumstances, possibly as much as several days. But the longer it's there, the more likely it is to disintegrate. A quick wipe with a 70% alcohol wipe, or with which is like rubbing alcohol or something like that, or with like a Clorox wipe or something of that sort, very rapidly inactivates the virus. So if someone's symptomatic, then it's appropriate to be doing that kind of decontamination on surfaces in your home. And if you must go out, you can consider having wipes like that with you to wipe down the grocery cart and things of that sort. At the present time, I think the other thing for us to all consider is the factor of loneliness. As we self-isolate, all of us are going to experience some of those effects. And it may be most intense for the people who are already somewhat isolated. So be sure you reach out to others if you feel isolated, or if you're simply trying to bridge or address the effects of isolation from others. Stay in touch with family and friends, with neighbors. If you need some help getting medications or groceries or anything else, reach out to friends and family, to your deacon, to others in the congregation with whom you feel comfortable chatting. There's certainly some delivery services available now. Walgreens and some of the other pharmacies, CVS, I think, are doing free home delivery. Some grocery stores are also doing delivery, and in others, you can pre-order, drive up, have the groceries brought out to your car with very limited direct contact. And those are all reasonable mechanisms. Going outside and walking around without close contact with other people is a really healthy way to stay both mentally and physically healthy under these circumstances. So if you have questions and you'd like to reach out to me, feel free to do that by email, text, or phone call. I'm happy to try to answer your questions if I can. And if you need help, as I said, reach out to your deacon, to others in the congregation, friends and family, and stay well. And we will all get through this together. Bye for now.